All right, good afternoon, Douglas County School District community, and thank you so much for joining us for this town hall meeting. My name is Nate Jones, and I'm the communications manager for the Douglas County School District, and I'm honored to be serving as tonight's moderator. Today's town hall is scheduled for an hour, and we know that there are a lot of questions that are being asked, so we're going to go ahead and jump right in. Today, you're going to hear from Douglas County School District Superintendent Thomas Tucker, as well as a special guest, Dr. Adam Barkin, who serves as the Emergency Services Medical Director at Skyridge Medical Center. After that, we will answer some of the questions that community members have submitted over the past few days via a survey, and we'll have a couple of community members join us live to ask their questions as well. I want to also acknowledge our Board of Education directors who are with us this evening, Directors David Ray, Krista Holtzman, Kevin Lung, Anthony Graziano, Christina Chanto-Shore, Elizabeth Hansen, and Susan Meek. Thank you so much for being with us this evening. And with that, we're going to go ahead and get started with some introductory remarks from Superintendent Dr. Thomas Tucker.
Thank you, Nate, and thank you to everyone who's out there listening. And good afternoon, Douglas County School District community. Thanks to each of you for transitioning to remote teaching and learning so quickly following spring break. I am extremely proud to serve as your superintendent and very thankful for what you do to meet the needs of each of our 68,000 students. You know, a great deal of inspiration is needed to overcome a generation-defining event like this pandemic. I am finding inspiration in places throughout our beautiful community. I'm inspired by the work of our Board of Education and district leadership team as they continue to help us set the direction to move us forward. I'm inspired by the countless stories of our staff as they rise to the challenge and shift their instruction to facilitate maximum learning for each of our students. And I'm certainly inspired by our food service team as they rise to the challenge to prepare over 19,000 meals weekly. And our transportation team as they rise to the challenge to help deliver some of those meals. I'm inspired by our classroom teachers who, like all of our colleagues, miss our students more than our students will ever know. And I'm inspired by each of you, by our students, our parents, staff, community members, and all those who continue to rise to the challenge in sharing positive messages of hope and inspiration. One of our colleagues, Kelly Duvall, who works in our district office, is also a grandparent in the school district. She has two children at Castle Rock Elementary School. Two great grandkids, Sophia and Emmett. And she says, you know what, we're going to be okay. And she shared with us that her two grandkids begin the day by reciting the Pledge of Allegiance. Then they engage in a couple of hours of remote teaching and learning. And then from there, they go to phys ed. And folks, phys ed is extremely beneficial. All of our specials are beneficial. So please try to ensure that your students are taking advantage of phys ed, music, and the arts. That really brings some sense of normalcy to their day. So Emmett and Sophia they go down to their nursery, which is on Kelly's farm. And so they take this mile walk from the house through the nursery. They get the blood up and going. And then I found this really interesting. They engage in the Castle Rock Elementary outdoor habitat experience. So they're really engaging in experiential learning. They're bringing not just bringing the outdoors to the classroom, they're going outside to the classroom and learning. Again, breaking up the monotony of the school day and really empowering students, her grandkids, to take control of their own learning. And then at the end of the day, being a country boy like me, they end with some agricultural responsibilities with the cattle. And that is in line with our high school career tech ed programs. As you know, at Douglas County High School, we have an outstanding 4-H program at Douglas County High School. And so young Sophia and Emmett are going to be ready for high school in a few years. Thanks, Nate.
Thank you, Dr. Tucker. You're going to be hearing from the superintendent a little bit more as we get into the town hall, or the Q&A portion of the town hall, in just a few minutes. But right now, I do have the privilege of introducing Dr. Barkin Emergency Services Medical Director from Skyridge Medical Center. And before I bring him on, I do want to thank once again our friends at Skyridge Medical Center who have been incredible partners to the Douglas County School District for many, many years. They made it possible last year to launch our DCSD mobile app. And of course, we've had a great partnership with them over the years as we bring the Parent University series to you every month. And I do recommend, if you're missing out on those, to check out our COVID resources page, because we are continuing those as a webinar series as we continue this new normal. Dr. Barkin, first, thank you so much for taking your time to be here with us today. You've been very gracious. This is your second town hall that you're joining us for. So thank you again for your time. Dr. Tucker did talk about the decision to close our schools and buildings for the remainder of the year and to continue with remote learning. Can you talk to us a little bit about how this type of decision, along with social distancing and the stay-at-home order measures, are helping to slow the spread of COVID-19?
Yeah, thanks, Nate. I appreciate you all having me here, and especially Dr. Tucker for hosting these town halls. On behalf of Skyridge, I just want to say thank you to all the citizens and community of Douglas County for all you're doing to really keep people safe, not only in your small towns, streets, but really our state. Social distancing, we weren't sure it was going to work, to be honest with you, when we started. We weren't sure how the coronavirus was spread. The key with the social distancing is flattening the curve. And this is something we've been hearing about for weeks, if not months now. The concern, and this really played out in Italy and also in New York City and some other places around the world, Spain, China for some time, was that the healthcare system became overwhelmed and couldn't take care of all of the patients who became ill from COVID-19. And hard decisions were required. Who gets a ventilator, who doesn't get a ventilator, who can be admitted to the hospital and who has to go home. Flattening the curve doesn't necessarily decrease the number of patients who overall get sick, although it seems actually to be doing that at this point because it's been so successful. It's really meant to decrease the burden on the healthcare system so that everyone who needs care when they get sick can get that care. If you're sick here in Colorado, anywhere really in the state, anywhere in the country, in Douglas County, Denver, Arapahoe County, and you get sick from COVID-19 and need to go to the hospital, you're going to get the best care you can possibly get, whether that's at Skyridge or any of the other hospitals in town. And social distancing has really been the key to that, in addition to hygiene and hand washing and just really reevaluating how we all go about our daily lives. But that social distancing component has been the key of preventing spread and making sure that when your family member or when yourself or when your grandmother or when your student or whoever it might be gets sick, they're going to get that care. And, the one thing I just want to, really, say at the start of this is that we've all been impacted by COVID-19, and Dr. Tucker spoke very eloquently about this. This has been incredibly disruptive to all of our lives, whether you're in healthcare, whether you're a teacher, whether you're a parent, or whether you're anything else in our community. Your lives are different than they were 2 weeks ago, let alone 4 to 6 weeks ago. And there's been many people who have known people, family members or friends who have become very ill and some who have lost their lives. We've been lucky here in Colorado because our social distancing and our lockdown has been incredibly successful. And the burden of COVID-19 in the state of Colorado has been remarkably low considering what it could have been. So again, I look forward to questions, and I'm thankful that I get to be part of this panel. Thank you.
Thank you, Dr. Barkin. Again, thank you so much for lending your credibility and your expertise to this discussion. Now we're going to answer some of the questions we have received from our community members through that survey that was sent out about a week ago. I want to note that we're going to answer as many common questions as we can during our hour today. Any questions we're not able to ask due to time constraints will be answered. We'll be posting a frequently asked questions document to the COVID-19 page on the DCSD website, hopefully early next week. So question one comes from Melanie, and she wants to ask, Dr. Tucker, can you tell us when students might be able to access the DCSD buildings to retrieve any belongings?
Thanks, Melody and Nate. I do appreciate the question. First, we understand that it's been extremely difficult for students and staff alike to be away from their schools during this period. But I want to really show some appreciation for the understanding and support we've seen for student and staff safety in keeping our buildings closed. And as Dr. Barkin said, also in our community, I am really impressed with how disciplined, if you will, our folks have been in trying their best to mitigate the spread of COVID-19, unlike in other places. So a big shout out for the folks here in Douglas County. And again, showing some appreciation for keeping our students and staff safe. Prior to allowing access, district operations and maintenance staff and qualified contractors who come in and assist us, Nate, will clean and disinfect our schools and buses in accordance with best practices and guidance from the Tri-County Health Department. All chemicals used meet Environmental Protection Agency requirements for COVID-19 virus. So it's going to eradicate the virus. Schools would also have been closed for a while, staff in the community for many weeks, which is well beyond the estimated time for the COVID-19 virus to survive. In-person learning will resume when all orders have been lifted or requirements and guidelines for social distancing, personal protection, hygiene, washing those hands for at least 20 seconds multiple times a day. Cleaning and disinfection can be accomplished in accordance with the Centers for Disease Control and our control and prevention measures that have been issued by the governor, the Colorado Department of Public Health, the environmental public health orders, as well as Tri-County Health Department. Again, a huge thank you to those organizations for giving us some proper hygiene tips. And as you know, the governor just yesterday, the governor talked about the stay-at-home order being in effect until April 26th, and large public gatherings will continue to be banned until further notice. And what I received from the governor's talk and what I read in the paper today, that there is a hint that the orders may be extended. So again, Nate, we're going to follow the tips and guidelines from our people in the health department and our great friends, of course, throughout the county and throughout the state. And we do appreciate our friends with Sky Ridge Medical Center for assisting us.
Great, thank you, Dr. Tucker. And Dr. Barkin, do you have anything to add about what that absence from our buildings will do to get us back to them sooner?
Well, I think, as Dr. Tucker said, I think, cleaning and disinfecting is really the key. The actual virus, the coronavirus, does live and is still transmissible for an extended period of time, depending on the surface. Now, at this point, most likely any virus that was at any school or anything else is now gone. I think it's still entirely worthwhile to pursue the deep cleaning and disinfecting and everything else. The virus is interesting because we talk about it's transmitted several ways, and we usually talk about these droplet transmission. So that's why the recommendation is that people wear a bandana or some kind of soft cloth over their mouth. That's really protecting other people, because if you sneeze or if you cough, those droplets can travel approximately 6 feet. So those barriers help prevent the ongoing spread if, for instance, you were an asymptomatic carrier of the virus. The other thing is the virus can also live on surfaces for an extended period of time. And that's, to Dr. Tucker's point, why this cleaning, disinfecting, and really putting this into effect when kids are back in school and teachers are back in school is going to be so important. Because, for instance, the virus can live on cardboard for up to 24 hours, stainless steel even longer. Plastic, it can live for up to 72 hours. So all those, that's, again, with the hand washing that Dr. Tucker talked about, with using hand sanitizer until your hands are raw, and then taking your disinfectant wipes, which either have hydrogen peroxide or a high alcohol content, and wiping down anything that may have been potentially contaminated by someone with current infection. So those are going to be the keys as we reopen schools, as we reopen parks and playgrounds, as we talk about the future, especially into the fall when schools hopefully will reopen throughout the state. There's going to be, it's going to be a little bit different world for all kids going back to school, let alone adults who are going back to office buildings and, you know, re-engaging with restaurants, bars, grocery stores, things like that.
Great, thank you for that insight. Our next question is actually going to come from a community member. I believe we have her on the line now. Ms. Tina Harris, are you there? Hello, Tina? I do see her in our Zoom chat here. Ms. Harris, can you hear us?
I can. Can you hear me?
There we go. How are you?
Okay. I'm good. How are you?
I'm doing fine. Go ahead and ask your question, please.
I'm wondering, can we set a date in July for graduation instead of having tentatives out there that could be canceled or pushed out again?
Thank you, Mrs. Harris. Dr. Tucker, did you hear Mrs. Harris's question?
Yes, I did. Mrs. Harris, how are you doing in your family?
We are doing very well. Thank you for asking.
Okay, I'm going to answer your question, and I'll try to not to use the word tentative more than one time. You know, it breaks my heart when we start to think about the class of 2020. There's no doubt about it. This coronavirus, COVID-19 disease has impacted every facet of our lives. There's no ifs and buts about it throughout this universe, throughout our country, and here in Douglas County. We've been greatly impacted. And we can argue, and it won't be an argument for me, it's mostly impacted our seniors. And I don't use this word lightly. They've been robbed. They've been robbed of their prom. They've been potentially robbed of their graduation. And we have a moral and an educational obligation to ensure that our children have some way of honoring them. In the next couple days, you're going to see one way that we have begun honoring our seniors. You'll just look around the neighborhoods and you'll see some things in the next couple days. But our children have been robbed. And I can tell you right now, our high school principals are not going to let that happen. They're not going to sit still and they're simply not going to let that happen. And I know our parents aren't either. And so it's extremely important that we honor this very, very important milestone. And I'm going to use the word tentatively one time. So we've scheduled graduation dates for the week of June 22nd through the 27th. Your respective principals, I'm sure they contacted you, parents and students last week about these tentative dates. And we're going to continue working closely with them because these great leaders believe that we need to have an in-person graduation ceremony if possible. So we have a backup date for July 22nd. That's the date we have in stone there, Mrs. Harris, that you talked about, as a backup date to the week of the 22nd through the 27th for in-person graduations. July 22nd, if possible, will be a traditional in-person graduation. But if we find out close to that point that we cannot have an in-person traditional graduation, we will have virtual graduations for our students. And you'll hear more about that as we get closer to that July date from your building principals. We have our two stadiums already set for July 22nd. There won't be any work going on in those stadiums. We're postponing the turf replacement so that we can properly, if possible, have an in-person graduation. Now, we all realize this isn't perfect, and we wish we could promise that the June dates would happen so that families could start planning and other relatives can make travel plans to help honor our outstanding seniors. But we have to continue to be mindful of the health guidelines and the situation that we're currently dealing with COVID-19.
Thank you, Dr. Tucker, and thank you, Mrs. Harris, for calling in tonight with that question. We're going to shift gears a little bit for question 3. This one comes from Ashley and focuses more on DCSD's financials. Dr. Tucker, can you explain the impact this pandemic may have on our per pupil funding for the upcoming school year and what that means exactly for DCSD?
Yeah, I'm going to do the best I can. Our experts will have a town hall meeting. I'm going to kick that off on next Thursday, the 23rd, with our interim CFOs, and they're going to discuss the financial impact, and we'll also have a board member on that panel as well. So please be sure to tune in on April 23rd. So that we can take a deeper dive into what the pandemic will mean for the school district's budget, in not only Douglas County School District's budget, but the budget of school districts across the state. So, but on Thursday, we're going to talk specifically about how this pandemic has impacted Douglas County. The pandemic has affected operations, as I said, everywhere in our country. There are over 13,500 proud public school districts in the country, and in each one of them is impacted in some shape, form, or fashion. The coronavirus pandemic has already pounded state budgets, as many of you know, and it will leave no school district unharmed next fiscal year, 2021 year. Furthermore, the shutdown of businesses and skyrocketing unemployment rates will crater state sales tax and income tax revenue, which many districts across the state and the country depend on. And my heart goes out for our parents and community members who have been furloughed, our community members who are in those occupations that have been hard hit. But please know that the Douglas County School District is going to do its part in being a great partner in the community. And we're going to demonstrate to our community that we are investing and we're using our expenses wisely. Nevertheless, the pandemic has reduced the projected 2021, that's next year's budget, per pupil revenue from original estimates shared in July. In fact, the Douglas County School District anticipates flat funding at best for 2021, Nate. Now, this is a change from our original projection of $222 per pupil increase for next year. So with that loss of $222 per pupil next year, that's a difference or a loss of $11 million in funding for district-run schools and departments alone. That's just for our district-run schools. I want to remind everyone, this is still an estimate, and our school district will know more information after the state releases its updated forecast on May 12th. Please note that funding may decrease from the current projections. That funding that I talked about earlier, it could be lower depending on the state's updated forecast. Now, the real depth of the cuts to K-12 specifically depends on several factors. And our experts will talk more about this next week, but the two main factors that you want to keep your eye on are how state lawmakers decide to spread the cuts among competing priorities to K-12, including Medicaid and higher education. Our central administration staff will present the 2021 proposed budget to the Board of Education on May 26th. So I do want our community members to tune into that as well. This 2-week delay is due to the state now releasing its updated forecast on May 12th. So the state has pushed back its date. We will present a proposed budget to the Board of Education with a list of budgetary cut options, and the Board of Education will decide on which options to implement. Principals should continue, I want to emphasize this, we want our outstanding building principals to continue with their current site-based budget, that's the individual school-based budget allocations for now, as it is undetermined which budgetary cut options will be implemented. And we're also, Nate, waiting to see how the state is going to be impacted with the funding from the CARES Act. As you know, there's $13.5 billion went to public education across this country as a result of COVID-19. And so we don't know what share we're going to get from the state. Those numbers have not been released. And there's also talk about a second stimulus package to really help out public ed. Again, we don't know where that is right now. Also, we'll host another town hall meeting again, in which we're going to dig deeper into this on April 23rd at 5 p.m.
Great. Thank you, Dr. Tucker. And our communications department will be putting out more information about that staff hall meeting early next week as well. Next question. And I do want to remind folks that we did get a lot of questions that were in the same vein as each other. There may be some slight differences. For any information that you're not getting tonight, we will be putting together a frequently asked questions document that we should have readily available early next week. This next question is a two-part question. This one was asked a lot. Is DCSD going to offer summer programs? And is there a chance DCSD could extend the current school year into the summer months? Dr. Tucker?
Those are very, very important questions. Those are questions that superintendents across the country, and especially my colleagues, my outstanding colleagues on the Front Range are pondering right now. What do we do with our summer programs? First, we don't have any plans to extend our school year. We're working closely with the Colorado Department of Education and have the waiver needed to finish off our current year remotely as we are doing. And so proud of our community, our students, staff, and parents, that on the Friday before spring break, they were able, those who needed their computers, who had computers at school, took those with them, and those who needed computers, from the district, were able to loan those out to get our remote teaching and learning program going. But Nate, in terms of the summer programs, as of today, the answer is that we're hopeful that all of our DCSD summer programs will take place as scheduled, including our base program. However, we're still waiting to hear from health experts and our governor on what will be recommended for summer programs. Again, the social distancing aspect of it, the gathering of 10 or less people. So we're still trying to figure that out, but we remain hopeful we'll be able to have some answers to those questions sometimes within the next few weeks. I'll ask Dr. Barkin, our expert here, what are some of your thoughts that we might expect come this summer, especially regarding groups of students, groups of staff members, or what have you, and parents coming together?
Yeah, I think, Dr. Tucker, it's a great question, and I think we still don't know enough yet. And what I want to remind people is that as of a couple months ago, we didn't know anything about coronavirus or COVID-19. It was in the news stories, but it really was not in the U.S. at all. And so this has been an incredibly rapidly evolving disease and process and treatment strategy from the medicine side, but also from the social side and the level of social distancing that's been required to really flatten that curve, as I talked about earlier. I think, Governor Polis is taking a very rational approach to how things are going to open up again. It's not flipping a light switch and getting everyone back into the economy full speed. He describes it as turning that dial. And the dial is going to turn very slowly as we start to open up, whatever it might be, whether it's camps, summer programs, bars, restaurants, hospitals, all these things that really are necessary, but we want to be careful because we don't want to see another spike in illnesses if we turn that dial too quickly. We do have the benefit of having other countries and states that are a bit ahead of us as far as where they are in the state of the disease. And so I think we can learn from other places as they begin to open what's safe and what's not safe. I don't think there's going to be a time in the near future where we're going to be going to, filling up, the Pepsi Center with 27,000 people. I think that's a long way off. But I do think there's opportunities that are going to be coming in the next, 6-8 weeks, even over the summer, where there's chances where you can maintain appropriate small groups with some social distancing and good hand washing and things like that, so that people can come back together. I think, that's what people miss. I mean, we're holding this town hall virtually right now. It'd be much nicer if we were all in a big auditorium and we could see each other and talk to each other. The number of Zoom meetings that I have, that everyone else on this call has for work or just having reconnecting with family members is astounding. So I think as much as anything, we do need to have, be careful in how we, twist that dial, but it's going to be important that we start doing that and bringing people back together face to face in a safe way.
Thanks, Dr. Barkin. And you had mentioned too that Douglas County comparatively has done pretty well at doing things like social distancing and adhering to some of the advice that's been put out. But while they're doing that, I think a lot of folks have questions about how they can stay healthy while social distancing, both mentally and physically during this time. Do you have any advice for folks that may be looking to keep active and stay sane?
Sure. So, I mean, I think, we really have to, give kudos to our whole state for taking this very seriously. If you look at the number of cases that we have in our state, just as of yesterday, we had 8,280. Douglas County has a proportionally very small number. I think it was, 312 as of yesterday, which is a really tiny number considering the number of people. And Douglas County, while not densely populated, is certainly more densely populated than some areas of our state. So social distancing has really been successful in our state. I think this whole idea of staying physically well is equally as important as staying mentally well. And so the physical side, avoiding getting sick, that's really the social distancing. That's how we stay 6 feet away. If we're going to the grocery store, if we're going to the pharmacy, we're going to put on that soft cloth over our mouth or a bandana to protect ourselves and protect others. It's the good hand washing, it's wiping things down as we talked about before. But I really want to emphasize this idea of mental wellness as well. This is hard. People have had incomes cut if they haven't lost their jobs altogether. Homeschooling is incredibly challenging. I have 2 young kids at my house, and moving from full-time doctor to also helping coordinate their education along with their teachers has been eye-opening and challenging and stressful. The ability or the inability to see family members and friends and even neighbors has been challenging. So I really do encourage everyone to spend time outside every day. Take that walk, take your dog out, go for a bike ride, do things that are safe. So you're still going to maintain good social distancing, but you're also going to take care of yourself. Binge on a Netflix series you haven't seen. Take time to meditate. Whatever it takes for you to find that self-care is as important as anything during this difficult time.
Thanks, Dr. Barkin. And just lastly, you had mentioned just finding different data points from different outlets. Is there one source that you prefer when you're looking for information that you would recommend to community members that might be looking for some data?
Yeah, so I think it partly depends on what you're looking for. So I go to the Colorado Department of Public Health website frequently. Every day they update the number of people who have the COVID-19 in our state, and they actually break it down by age, by gender, and then also by county. So you can find very easily, how many people had COVID in Douglas County yesterday versus today. And they also have, the Colorado website also has a tremendous number of resources for how to take care of yourself, signs and symptoms to watch for. And then the other website is the CDC website, which has more national data as far as numbers, but it also has a lot of very helpful PDFs and information sheets for how to take care of yourself if you do get sick, when to go to the emergency department, and how to take care of family members, how to interact with pets. All those things are readily available. Those are my 2 go-to websites, both as a parent and a community member and also as a physician.
Great. Thanks, Dr. Barkin. Dr. Tucker, talking about day-to-day operations for the school district, our next question comes from Jeff, who's asking, is there a feeling that there will be a need to catch up on any learning the subsequent year? So like next year, for any students that are going to be impacted by by the change in existing curriculum? Is there any concern in that regard?
That is certainly on the minds of educators across the country. It's on the minds of educators here in our district. We have a moral and an educational obligation to ensure that every student, each of our 68,000 students, receives a free and an appropriate public education. That our students do experience some academic growth over the remainder of this year. And Nate, remember, we've had 3 full 9 weeks of instruction. So it's not like the school year is a total wash or loss. Our kids have shown some tremendous growth over these first 9 weeks. However, and I want to emphasize this, we need to ensure that every student, regardless of his or her unique learning abilities, has an opportunity to show growth over this year. And that it's not just a matter of kids hopping online for an hour or so and not growing academically. And how you grow academically is more than just what students are reading in a textbook. It's some of the life skills that students will develop. It's also has been an opportunity for many of our students to go deeper into a subject matter that they have not had an opportunity to grow. But there's also a national recognition that some learning will be lost. I mean, when you look at the big high stakes test makers, they've pared back their testing requirements. Some of our friends in higher ed are now foregoing the ACT and SAT as an admission requirement for kids being admitted this year in 20 as well as in 21. Again, I'm not saying this is happening across the country, but there's a lot of steam in that direction. Then also, there's quite a bit of research out there regarding the proverbial summer slide. So we're all cognizant of that. But I want to focus my attention on what we've done here and what we're going to do here in the Douglas County School District. First, I want to thank our amazing, and I do mean amazing staff and our parents, particularly our staff who have created the Douglas County School District Remote Teaching and Learning Plan, and our parents who are now teachers, as Dr. Barkin said, who are helping us implement that plan. And that includes, again, our parents, our students, our principals, and all of our educators. And they've provided some very crucial input in the development and the workings of that plan. We also have an ever-evolving, frequently asked question comment that's attached to our plan, where we're taking questions, considerations that parents are giving us. But I also want to say this, and I know our staff members have reached out to our kids, but I want to say to our parents, if your child has not been contacted by a staff member, that's not okay. It's simply not okay, and we need to know. And we do know that we have a handful of students who have some unique needs that we need to reach out to those students as well. And we are so thankful to have a partnership with other agencies in our community to help us reach all 68,000 of our students in our community. Right now, and this is something that's a hallmark of what we're trying to do. This is a hallmark of our strategic plan, and that is to focus on relationships. That's the most important thing right now. And when you look at the core tenets of our remote learning plan, it's about keeping students connected and engaged. You're going to hear quite a bit today, as well as in the future, about the being connected, being engaged, and addressing the social and emotional mental health needs of our students and our staff. Sky Ridge, as you mentioned, Nate, earlier, has been a huge partner, not just during this COVID-19 episode, but they've been partners for us for many years now in helping us reach our students and staff, in helping them build agency to address some of the mental health issues that they may have. So we want to continue that. And also a big shout out to the entire medical community. They've been fantastic to the Douglas County School District. And talking a little bit about engagement, accountability and engagement in any learning environment, they're created through strong relationships. It's not through compliance, it's through strong relationships and learning opportunities that are based on students' interests and needs while helping them make personal connections to their learning. And another reason, Nate, that I say that this COVID-19 is not going to defeat us. It's not going to defeat our students learning here in the Douglas County School District, because I've heard from many students, I've read narratives and I've heard anecdotal records where students are now able to go deeper into a subject matter that in the course of a normal school year or a normal grading period, they wouldn't have an opportunity to do so. They're also learning some very, very important life skills. And here in public education, we're criticized often, and probably it's due that we have gotten away from teaching kids life skills, important life skills, how to balance a checkbook, how to sew, how to cook. This is an opportunity for us to teach our kids those important skills. Great opportunity to do that and not focus so much on testing. Kudos to the Colorado Department of Education for not requiring the CMAS testing. As you heard me say a little over 2 years ago when I came into district, we were testing kids to death, and we're testing, and testing is okay, but we're testing them on things that are not really important. And so we will not be defeated by COVID. This is a shared bit of humanity that all of us across this beautiful globe are going through right now. Teachers and staff are using creative and innovative methods such as virtual morning meetings that I've heard parents talk about, online communities through the Google Suite, weekly challenges, peer-to-peer feedback, and other measures to keep students plugged in. And they are really taking advantage of that Monday morning planning time to plan exciting lessons for our students. And parents, please use that as a time to take a breather as well. And we want our students to take a breather. We don't want to stress our students out. If you feel that your students are being stressed out, please contact your teachers and your building principals. And this is also a unique learning opportunity to move students from engagement to empowerment. Again, you get your greatest lesson, folks, when kids feel empowered to take control of their own lesson by providing them skills and tools to pursue their own interests and passions. I'm excited. I am really excited to talk with our students once we come back together and find out some of their new passions and some of the new interests that they've developed over these last several weeks. So I do know this for a fact and I look at my 4 children, I know that when they feel empowered and they have some control of their lessons, they hold themselves accountable. And the last thing I do want to mention here is that our district is situated under the leadership of Mr. Matt Reynolds to look at, to take some baseline data that's not tied to CMAS, not tied to any formative assessment, not tied to gradings, any grades or what have you. We can create this baseline data to see where students are now. And then when we come back in the fall, we can assess them again to see how much learning they've lost during the summer and this fourth 9 weeks.
Fantastic. I feel like that's probably a good opportunity to talk about the lunch I had with my son the other day, where he pulled me aside to show me some science experiments that he had learned directly from class. So it is sticking. And I do want to give a shout out to Mr. Rasavage at Rockridge Elementary for keeping my kid engaged, even if it came at the cost of getting the Liberty Kids theme song stuck in my head. So thank you for keeping him engaged, even if there was a bit of a cost there. Our next question is actually from Cindy, and it's a pretty common one. We got a lot of questions in the same vein. Will student fees such as those paid for lunches, athletics, transportation, et cetera, will those be refunded? And if so, when and how?
Cindy, thanks for that really popular question. Yes, the participation fee for spring sports will be refunded, as well as a portion of bus passes, among many other student fees. So please look for communication coming soon for details. These refunds will be automatic with the exception of lunch balances. Lunch balances will be refunded per family request, or those fees can be rolled to next year or rolled to another family member or donated to the Foundation for Douglas County Schools.
Great, thank you, Dr. Tucker. And looking at the time, this is probably going to be our last question. This may be something that both Dr. Tucker and Dr. Barkin may want to chime in on. This question comes to us from Amanda. She asks, has there been thoughts of continuing remote learning into next fall? And is there a way to get back into the classroom and abide by social distancing? What measures can DCSD take to keep students safe when they return to the classroom? Dr. Tucker, we'll start with you.
Well, Nate, I was going to ask Dr. Barkin to talk a little bit about that, because early on, he gave me some ideas about social distancing in the school setting, particularly looking at certain numbers, whether it's in the classroom or cafeteria. So let's start with a medical perspective, and then I'll give a school perspective.
Thanks, Dr. Tucker. Yeah, so I think that, again, time will tell as much as anything. Assuming that the virus starts to, go away out of our communities this summer, I'm hopeful for my kids and for every kid in Douglas County that they can go back and be with their friends and be with their teachers in the fall. I think that there are likely going to need to be some changes how every school and really every large organization structures their environment. And the examples I would give, you may not be able to have 300 or 400 or more kids in the lunchroom at one time. There may need to be some alternatives made so that you have 20 kids eating lunch in a more communal, intimate setting where you're still trying to maintain some social distancing. And the schools and every other organization are going to have to be really careful about having hand sanitizer, sort of readily available. There's going to be excess attention to, wiping things down to, assure safety. So there may not be the same large scale gatherings at schools that there have been in the past. But I think with creativity and some innovation and really attention, that there's no reason that we can't resume some normalcy, especially for our kids, who I think are desperate to see their friends, desperate to run around on the playground at recess. I can speak certainly for my kids who are, tired of asking me, what are we doing for PE today? They would much rather be with their friends doing it themselves, with their teachers and their coaches. So I'm hopeful that can happen. I do think that it's going to look different for an extended period of time, but I am hopeful.
Great, thank you, Dr. Barkin. Dr. Tucker, did you have anything that you wanted to add to that?
Yes, I certainly want to emphasize a point that Dr. Barkin made, that it may look different. And I'll ask our people, don't take this as the gospel. When you look at schools that have opened or slowly opening in Europe and in the Asian countries, kids are wearing some type of face covering. Again, I'm not saying we're going to do that here in the Douglas County School District, but as you know, right now, when you look at the governor's order, he's stating that whenever you come outside, you should have some type of face covering on. And that may be, again, he hinted yesterday that may be hinted. I mean, he hinted at that may continue in the fall and for the months to come. So that's certainly something to think about. But yes, want to make sure we answer Amanda's question. Yes, we are looking at the possibility of continuing remote learning, in the fall. We hope not. We really hope not. But at the same time, we have to be prepared if that does happen. We do know some of our friends in higher ed have extended their remote learning, their online learning into the fall. So again, preparing and praying for a normal opening, but at the same time being prepared to continue remote learning in the fall. And additionally, as I said earlier, we plan on having our summer programs, but it's something that we're going to have to continue to closely monitor. As you know, we're in close contact with our local health experts, other superintendents on the front range. We're talking every day, 3, 4, 5 times a day. The Colorado Department of Education, which is trying to give us as much guidance as possible, and the governor's office. So it really depends on what's unfolds over the next month, or particularly the next couple of weeks, when the governor is due to make some comments, Nate, on social distancing and closures as well. Will it be a soft opening of the economy or what have you? So again, staying on top of those things, staying in close contact with our healthcare folks, but also preparing for the future, having contingency plans in place. And I am extremely, again, proud of our parents, our community members, on your level of flexibility and the nimbleness, if you will, of our staff. We planned ahead, and we wanted to, again, ensure that our students, we had a good feel vis-a-vis a survey on which kids needed computers and Wi-Fi devices. And a huge thank you to Mr. Sethi and his team for handing out thousands, I think we're well over, 1,000 or 2,000, I guess, devices that we did hand out. So I'm very proud of that. I'm proud of that nimbleness and our folks who jumped in to help out. But also, it's important that we continue to make those decisions for the fall, and make those decisions with input from our staff, all of our educators, our principals, and our students. Our students are very instrumental in this. Our student advisory group is another group that gives us feedback in terms of how our remote learning plan is going, what are some of these successes and ways that we can improve it. So we'll certainly have conversations, Nate, and our folks out there with our students.
Fantastic. Thank you, Dr. Tucker. We are getting close to the end of our time. I do want to remind folks that if you submitted a question and you didn't feel as though it was answered during the town hall, we will be putting out an FAQ sheet on sometime early next week, and you'll be able to find that on our COVID-19 page and our community resources page, which is linked to that COVID-19 page. Dr. Tucker and Dr. Barkin, did either of you have any closing remarks that you'd like to make before we wrap up?
We'll ask Dr. Barkin to give us his closing remarks first. And certainly we owe Skyridge and Dr. Barkin and our friends there a huge debt of gratitude for not only assisting us with this town hall, but also their continued support of the Douglas County School District. So we'll ask Dr. Barkin to give us a couple comments, and then we want to hear from President Ray. I think President Ray, our president of the school board, to make a couple comments, and then I'll close with some very brief remarks, Nate.
Well, thanks again for having me today. It's an honor. I just want to say a couple things. This is a hard time for everyone. I want to assure everyone that your hospitals, your healthcare workers are still there for you, just like your teachers are there for you to help with distance learning and virtual learning. Our hospitals are open. Skyridge and our emergency department, we've been dealing with infections for a long time. We have screening processes, we have cleaning processes. We're ready to take care of any patient who has COVID or not have COVID. What I want to reassure people is that we're ready, and that this is what we do. And I don't want people sitting at home thinking they can't come to the hospital because it's not safe. Our hospital is safe. We're expanding our testing rapidly for COVID. That's going to continue to expand dramatically over the weeks and months to come. I hate to hear the stories where people don't want to come to the hospital because they're nervous. If you think you have some serious medical condition, please call us. We're always ready to answer the phone. We can try and help you over the phone, or come see us. And I promise you that we will take good care of you. And that extends really not just to Skyridge, but to every healthcare facility, whether it's your primary care doctor, your urgent care, your nurse practitioner, whoever it might be. The healthcare professionals in Colorado are ready to help you in whatever way that we can as we emerge through this crisis and from this crisis. And we want to make sure that you get the really the optimal health care that you can. So again, thank you for having me today very much.
Thank you, Dr. Barkin. And Dr. Tucker, if you would like to introduce President Ray.
President Ray, would you please make a few remarks? As all of you know, Mr. Ray, David Ray, is former educator in the Douglas County School District and is serving his second term, elected term, on the Douglas County Board of Education. Mr. Ray.
Well, thank you, Dr. Tucker. And again, Dr. Barkin as well. Thank you so much for this session. What an incredible information session that has been presented tonight that I've learned a great deal just being able to listen in on this as well. And want to thank our community. We just know that we could not be doing this without an incredible supportive community. And you know, Dr. Tucker, I was just thinking a couple of seconds ago how ironic it was that you and your staff set the tagline of growing together this year when we started off and launched the strategic plan. And boy, I can't think of a better tagline than doing this together because it takes all our agencies, like Dr. Barkin is a representative, as well as our community, as well as our staff. And so just deeply proud of the other 6 directors that I get to surround myself with that are on the board who are absolutely relentless in wanting to make sure that everything is done for the best sake of our children, and so proud of them. They're listening intently, just as we are, to really begin understanding what our next steps should be. And certainly want to invite our community to also listen into our future board meetings. We have some pretty tough decisions to make, as Dr. Tucker outlined today, especially around our finances. And so again, it's going to take all of us to put our heads together and really problem solve and come up with some really some strategies for how we continue to navigate such difficult circumstances. So our next board meeting, I'll just put a plug in for that, is next Tuesday at 5:30, and it's set up just like this format is. Thank you to Nate and the communications department for helping us with that, but it's set up just like this. And we will be continuing down this journey of looking at things that we need to consider as we face some pretty difficult, challenging times ahead of us. But again, I want to just thank Dr. Tucker, your leadership. I love it when I hear you talk about that the main goal of our remote learning is for connection, engagement, and relationships. And I couldn't agree more. And I know all our board directors feel the same way. And I know some of our parents feel kind of stress about whether or not to replicate a classroom in their home. And that certainly was never the intent. The intent was just to maintain that connection with our kids, to provide opportunities, like you said, Dr. Tucker, for some continued learning. And so we really hope that our parents take it easy on themselves during this time too, and making sure that there's not the added stress of feeling like there's a perfect way, because there's not. There are just so many creative ways to do it, and we don't expect perfection. So again, on behalf of my colleagues who I'm truly honored to serve with, we want to thank our community for all your work, all your support, and also to our staff for just how incredible they have been through these difficult times. So thank you again, Dr. Tucker and Dr. Barkin, again, for all your great work.
Thank you, Director Ray. We appreciate those words. And my last closing thoughts are this: practice grace and forgiveness, take a deep breath, and give yourself a break. Whether you are a student, a parent, a teacher, an administrator, a staff member, or you are wearing several of those hats, doggone it, it's going to be okay. We're going to make it through this, and we're going to come away stronger than ever before. We're going to do this together because we are Douglas County School District proud. Thank you, Nate.
Thank you, Dr. Tucker, and thank you again to Dr. Barkin for joining us, and Sky Ridge Medical Center for continuing to partner with us with these town hall meetings, with Parent University, and just being a great neighbor here in Douglas County. President Ray, thank you too for stopping by, and the other board directors that were with us this evening, thank you so much. And thank you to the community that joined us for this town hall meeting. We'll have another one next week. Mark your calendars. We'll be diving into the DCSD budget and financial implications of the COVID-19 pandemic. That's going to take place Thursday, April 23rd at 5 p.m. You'll receive more information via email in the coming days. Thank you again for joining us, and please have a great rest of your evening and a great weekend.